This is week 6, video 2 on healthcare policy for vulnerable populations. First, we're going to talk about female reproductive health. Policies and initiatives related to female reproductive health are varied across states and countries and regions, particularly right now, because as we know, there was a national finding called Roe versus Wade that was overturned by the Supreme Court, that was the right for someone to have an abortion. And the Supreme Court overturned that and said it's up to the state. So it varies by which state you are in, what that portion of your reproductive health can be. And different laws related to female reproductive health are included in those different interpretations or different laws in each state. Access to reproductive health care. Governments and international organizations often prioritize ensuring the access to reproductive health care services for women. And that includes not just when we think about what to do if one is pregnant, but these are things like family planning, contraception, prenatal care, and other maternal health services. These can provide affordable or free contraceptives, as well as programs that will improve the access to reproductive health in rural or underserved areas. Sex education. Comprehensive sex education programs aim to provide young people with accurate information about reproductive health, including contraception, sexually transmitted infections, consent, and healthy relationships. These are often advocated by health organizations and educators to empower teens to make informed decisions. In some areas, parents object to this education being done in school because they think that they should be able to more closely monitor what education is provided for their child. Maternal health initiatives. We know that even though we are one of the richest countries in the world, we do not rank high in maternal and child and newborn morbidity or mortality. So not just here, but everywhere, having maternal health initiatives during pregnancy, childbirth, and postpartum is going to make a better and healthier mother and child. We can pay for increased training. We can pay for essential supplies and emergency obstetric care with this funding. Family planning programs, trying to ensure that and empower women and couples to make voluntary decisions about the number and the spacing of their children. It has been shown that this will improve their quality of life. So that may involve the provision of contraception, counseling services, and other support for reproductive decision making. Legal frameworks play a crucial role in protecting women's reproductive rights and ensuring access to healthcare services. That includes laws that guarantee access to safe and legal abortion services, protect against gender-based discrimination in healthcare, and ensure access to maternity leave and other forms of support for pregnant women and new mothers. As I have said often this semester, this is all up in the air. I don't know what's going to happen in regards to female reproductive health. But we do know that we want to do everything we can, not just to ensure babies are born, but ensure that they are born healthy, that their mother is healthy, and that they have a quality of life after birth. Gender equality initiatives as addressing gender inequality promotes women's health and rights. Looking at things like gender-based violence, promoting women's education and economic empowerment so they are not dependent, and trying to challenge harmful gender norms and stereotypes. There are international agreements and conventions. There's an International Conference on Population and Development, the Program of Action and Convention on the Elimination of All Forms of Discrimination Against Women. These provide frameworks to promote women's reproductive health at the global level, and they prioritize contraception, safe abortion when needed or desired, and maternal health care. Community-based initiatives. These engage local communities in promoting women's reproductive health and rights. They involve grassroots organizations, community health workers, religious leaders, and other stakeholders to raise awareness, provide education, and deliver healthcare services at the community level to ensure that healthcare is provided for even those who can't afford it. What are the barriers? There's financial constraint. Women may lack health insurance coverage or financial resources to pay for health care out of pocket. Getting any significant barriers erased is very important. Lack of health insurance. Where there is not universal health care, health insurance not having it can prevent women from accessing essential reproductive health care services. And even when there is universal coverage, sometimes health services may not be fully covered. Geographic barriers. If you're living in a rural or remote areas, you may face challenges accessing reproductive health care due to the long distance to a healthcare facility, limited transportation, and lack of healthcare providers in these communities. Stigma and discrimination. There is stigma surrounding reproductive health issues such as contraception, abortion, and sexually transmitted infection that can deter women from seeking care. We see this more acutely in vulnerable population, and those include women of color, LGBTQ plus individuals, and women living with disabilities. Language and cultural barriers can hinder communication between healthcare providers and patients. That can lead to misunderstanding or reduce access to care. You need to meet people at their cultural norm and know what taboos there are surrounding this topic to make sure that you can discuss their reproductive health needs openly with them, and that they will share with you. And then legal restrictions and policy barriers in some states. There is very restrictive abortion laws or policies that may also restrict contraception. These can pose a significant barrier to care for vulnerable women who can't afford to go somewhere else to get the care that they need. Lack of education and awareness. If your education is limited and you do not have a good awareness of reproductive health issues, that can prevent a woman from understanding their needs and accessing appropriate services. This may lead to misinformation and myths being believed more than the actual evidence-based practice. Comprehensive services may be limited in some areas, or for people who do not have comprehensive health insurance. These include family planning, maternal health, STI, STD, and prevention and treatment. This access can cause issues and impact reproductive health negatively. And then a big one is mistrust of healthcare providers. If they can't trust us, they're not going to disclose sensitive or seek care from us. They're not going to want to disclose sensitive information, particularly if they're afraid of being stigmatized. What advancements have we seen? Well, we'll see if this continues, but there is increased access to contraception, not just in the United States, but in many countries. Reducing unintended pregnancies can impact positively maternal morbidity and mortality, and not only just improve their autonomy, particularly in areas where women are having many, many children. And we know that the more children you have, the more possibilities of having an adverse outcome in your pregnancy can occur. The legalization of abortion, which may or may not continue depending on where you're living. Yes, some people get abortion because they don't want to be pregnant, but remember, some people get abortion because they have been raped. There might have been incest involved. They may have a negative outcome coming for their pregnancy, such as an anencephalic baby or some other catastrophic birth defects. The pregnancy may be impacting their health. We need to think about that comprehensively as healthcare providers and politicians, and not just get caught in one note. And there has been expansions of maternal health services by governments and international organizations, making sure people get the care that they need. I'm not sure where that is going to go. Integration of reproductive health into universal health care coverage is very positive. Promoting comprehensive sex education, advancing reproductive rights. Making sure we're getting the women's voice and perspectives when making decisions about women's health is something that is an advancement and is a very positive one. Using technology and innovation to provide access to reproductive health care services has been a very positive advancement, particularly for those in rural areas. So overall, we have made big advancements. We need to continue to strengthen and implement comprehensive reproductive health care. Even though we've made many medical advancements, this is a case where the legislation and policy may negatively impact healthcare. We have to see what is going on. And I'm just saying that. I'm trying not to take sides. I'm just saying that we need to look at this as a very complex and comprehensive issue and not just take one side or the other. As healthcare providers and advocates, we need to look at this holistically and find holistic answers, not just based on what the far right or the far left believes. Healthcare disparities and challenges for the LGBTQ plus community. I was raised as a healthcare worker. I was raised, as I have said in the past, in the 80s when the AIDS epidemic began, when HIV started to be seen, particularly in the gay male community. And some people thought that it was just something that was going to impact them, and they thought it was something to punish them, which was very short-sighted, because we know that initially what we called it when I studied it in college, it was HTLV3. That was what the virus was named, but as more studies were done, there was a progression and an evolution of what we called it and what we knew about it. But this community often face stigma and discrimination in healthcare settings, so they don't want to come to the healthcare setting, particularly if they have something that, such as HIV. Discriminatory attitudes and behaviors from healthcare providers can undermine trust and make them not want to come and cause negative outcomes. Lack of cultural competence. If we don't have an understanding of the unique healthcare needs and experiences of this community, we may give them suboptimal care, misdiagnose, or give them inappropriate treatment. So we have to improve our cultural competence when it comes to addressing the needs of the LGBTQ plus community. Barriers to healthcare. They may lack insurance coverage, financial constraints, transportation issues, geographic disparities in healthcare access. The big thing is discriminatory practices, like they may have be refused or denied services based on their sexual orientation or gender identity. That can exacerbate the barrier. Health disparities. We do see disparities in health outcomes compared to heterosexual populations and cisgender counterparts. These can include higher rates of mental health disorders, substance abuse, HIV/AIDS, some cancers, and other chronic conditions. Social determinants of health, such as stigma, discrimination, and lack of social support, can contribute to these disparities. Gender-affirming care. Transgender and gender nonconforming individuals may face huge challenges accessing gender-affirming healthcare services, including hormone therapy, surgery, mental health support, particularly in our political climate now. There is a push to limit access to these services. Reproductive health care. LGBTQ plus individuals may encounter obstacles when they are seeking reproductive health services like family planning, fertility treatments, prenatal care. Assumptions about their sexual orientation, their gender identity, and family structure can often lead to insensitive or discriminatory treatment by healthcare providers. Legal and policy barriers exist, and even though there are advocacy efforts to challenge discriminatory laws, I fear that there is a conservative push to limit the rights of folks in this population, which can impact their ability to get health care. Intersectional identities. LGBTQ plus individuals experience intersecting forms of discrimination based on race, ethnicity, disability, socioeconomic status, and other factors. This intersectionality magnifies their healthcare disparities, and it shows us that we really need to address multiple dimensions of identity in healthcare policies and practices. So there have been advocacy efforts, legalization of same-sex marriage. There are anti-discrimination laws. There has been transgender rights legislation. Unfortunately, the flip is occurring now with limiting transgender care. Bans on conversion therapy, ensuring that healthcare access and coverage is available is a huge advocacy area for this population. hate crime legislation, ensuring that people are punished if they have been pursuing illegal activity related to the fact that a group or person is in the LGBTQ plus community. Parental and family rights. Advocacy effort focused on advancing the rights for these individuals, including adoption and parenting laws that recognize and protect their families. There have been some reforms and allowing them to be recognized as parents and allow adoption and foster care services for individuals and couples. And then global advocacy, there's global awareness of disparities and issues faced by the LGBTQ plus on a population on a global stage, and looking at this holistically as something that we as a world need to address is definitely something that has happened over the past 40 years. So overall, advocacy efforts have been instrumental in driving positive changes in the policy landscape for the LGBTQ plus population, their rights, their health care. Although there has been progress, there is work to be done, but I'm afraid that the direction our country is taking may either limit us moving forward in ensuring health care for this population, or may actually cause us to regress. It will be up to us to decide based on our beliefs as both individuals and as professional nurses, which direction we want to take in our advocacy efforts for this population.